So and so pregnancy tea helps with it has all those minerals in it, like, you know, the red raspberry leaf tea has the calcium. So which is good for muscle and, you know, calcium, magnesium, how they go in and out of the muscle.
Yeah.
And then the hibiscus flower too helps with the vitamin C, because all those blood vessels in there are collagen, and vitamin C is one of the foundations, that and the B complex that goes along with the vitamin C. What?
You're bringing the lab to me? Is that what that is for the
Yeah,
TSH?
we have to. They have to be spun within 2 hours of drawing.
Oh,
so.
wow. Thanks for doing that. So
Yes.
here's my fish oil. I've been taking 3 instead of 2 a day.
Shouldn't hurt anything.
Yeah, I just...
Well, I mean, it's the same cost, so
if it's the same cost, if y'all were going to charge her the $120 regardless, then go ahead and do a BPP also.
that'll make us feel better.
Okay, thanks so much. Bye-bye. She said placenta's not even close to the scar.
Awesome. Awesome, awesome.
Which wouldn't that naturally happen anyway? Because, like,
well, here's the deal. You have a C-section, and they got to where they were, instead of doing 2 layers of sutures, they were doing a single layer. And so about 1998, Ina May Gaskin published this thing in the midwifery literature that these single layer sutures are killing people. Because some, occasionally, not always, but sometimes the placenta will attach to the incision and it can grow through it. And so women were dying from this phenomena of placenta percreta, where it grows through the uterine wall.
oh my goodness.
So
into their body cavity? Like,
yeah.
crazy, or into the middle of the, well, anyway.
Yeah. So, like, it just seemed kind of crazy to me, because we've been doing all these VBACs, but Ina May is very well respected, and so we've just started, like, looking, is it a single layer suture or a double layer suture? And we just put the word out, be careful, to the doctors, and some doctors are real good, they go, I double sutured you, and then other doctors are like, oh, it doesn't matter, and they just do a single layer.
Mm-hmm.
So, we just look to see where's the placenta located, and if it's, hers was anterior and it was a previa, and it's grown. Oh, it doesn't really grow, but as the uterus is grown,
moves, you mean the
yeah, it
placenta
moves
moves up.
upward with the pregnancy. But so that's what we were doing, was looking to see how it grown through the wall. Is this a dangerous home birth, or is this a birth that can happen at home?
Okay.
Basically.
Cool.
So.
Yeah, I know the previa is when it's over the cervix.
Yeah.
And then, but usually it moves on its own, or
It can.
sometimes.
Yeah, sometimes it doesn't, and people have to have a C-section. But so we were. Anyway,
Just crossing all of our T's and dotting our I's.
Yeah.
Yeah,
We want healthy mom and baby.
we definitely do. So how's your diet?
I haven't been eating eggs like every day, but I still eat a ton of eggs, and I have incorporated a ton of cream. I go through so much cream. Anyway, but yeah, I eat like a giant salad. I mean giant salad, like this bowl, because he won't even eat it. So I eat that with the good greens at least 2 or 3 times a week. But it's definitely more than 1 serving, you know what I'm saying? It's like,
Okay.
and I think it's good. I eat meat, but I eat vegetables. And I'm trying to eat a banana a day.
Okay.
But I've been to Chick-fil-A like twice and had
Oh.
white bread.
Okay. Not
But
so
it's
good.
not, I mean, I don't eat like white bread all day long. And I made my own pumpkin pie, so I didn't even get that much sweets. I made my own condensed milk because the corn syrup took me 5 hours, but I did it.
Yeah, wow. I'm so proud of you. No wonder you're tired.
That migraine really got me on track. I was like, no. And
Yeah,
I
that's
went
why
to
I
the
gave
same
you that
place.
little. Sorry I had that migraine. I'm glad you figured it out though.
I'm pretty sure because it happened right after an allergic reaction. And I've had like 3 my whole life. I don't usually get headaches. And I refused to take Tylenol or anything.
Yeah.
So I just like suffered through it for 3 days.
I think that's a good thing.
Well, I noticed that the more you take it, the more you need it. Like years and years ago, before I had him, I was living in California. I always was taking. I would take 800 milligram ibuprofen every time I had a period. Like, I mean, just constantly. Tylenol, it was, you know. No, I just don't take any of it now at all. I just don't. Unless, now if he has like a deathly fever, I'll give it to him, but
that's different.
It. You know, that's it. It's
and if you have a deathly fever while you're pregnant, I want you to take some Tylenol too.
Okay. Well, yeah, I just don't get that.
The fever itself, if you're too hot, is bad for the baby because they cannot shed their heat whatsoever.
Right.
So ice pack your arms, whatever you need to do if you get a fever, you want to get that down below 101 and keep it below 101.
Okay.
So then you texted me that you wanted to do this TSH, T4. So what's going on?
Well, the only there's a couple of reasons. It was 2.5 years ago. It was 2.0 my TSH, and I don't know what my T3, T4 was. But I always had cold feet and thin eyebrows and dry skin and all that kind of stuff, and I was like depressed and whatever. Then I did all the iodine stuff a few months ago, and then we moved here, but I got fogged at the hotel room with this crazy pesticide, which apparently can make your TSH higher. So supposedly too much iodine can make it higher, but also supposedly if you have a reaction to something you're allergic to, which I'm allergic to the daisy family, so the pesticide was peripherins or whatever, so I had a major like my eosinophils were like really high right after that, and my TSH was like 2.5, and so I was like, well, and the new studies are saying that that's subclinical hypothyroidism, and so I don't know if it was a little bit higher because I took iodine or just because I got fogged with the pesticide, but I know that your thyroid can have to do with your pregnancy, and so I just kind of want to check it out, and because and I did get finally some more iodine, but I don't take it, like they want you to take like 3 drops a day, and I looked up the upper limit, and the upper limit is like 1,100 micrograms for pregnant women, but I also eat dairy, and I know it's in there, so I take 1 drop every couple of days, and 1 drop has like 400 micrograms.
You probably could take 1 drop every day.
Even though I probably eat like, I eat a ton of dairy, so I don't know how much I eat.
Like a medium potato had 400 micrograms.
Yeah, I ate a lot of potato. It was like, so I looked at the list of foods that have it, and it was like, I think I might be eating 800 micrograms a day, because I eat potatoes and I think eggs.
You have to have the skins on the potatoes.
Oh yeah.
So you have to eat the skins.
Yeah, I leave the skins.
Cranberries have it in it.
I've been eating a ton of that too.
Okay. We looked up what the up-to-date stuff is, so like the stuff that's just come out currently.
Okay.
And basically they said for women in the U.S. to achieve the daily level of intake that the ATA, the American Thyroid Association, recommends, you need, the range is 600 to 1,100 micrograms daily. So it says during the 10th to 12th week of gestation, fetal TSH appears, and the fetal thyroid is capable of concentrating iodine and synthesizing the iodine thyronines. However, little hormone synthesis occurs until the 18th to 20th week, and therefore the secretions start gradually. So, whenever it's going to drop off, they said that it can drop off, but like when we were researching it, and this is the reason why we were asking you about it, is because it says just getting your free T4s is not a good indication of anything, because you can have low free T4s in pregnancy, you can have the normals, and it's okay to have high ones.
Okay. Well,
So,
my T3,
doing that
T4 was
alone-
normal, but my TSH is what was kind of high. But my T3, T4 was fine.
And during pregnancy,
and that was before I was pregnant too.
During pregnancy, your TSHs are going to increase. They increase at the beginning, and then they slowly titrate off.
So it might even be higher than it was.
Yes. Because it says first trimester, it should be between 0.1 to 2.5. Second trimester should be anywhere between 0.2 to 3. And third trimester is going to be 0.3 to 3. So they're all changed based on trimesters, but you can't look at them individually like T3 versus T4 because there's not a good
You have to look at the TSH and the T3. Yeah, that's
like
what
you
I
have
was
to do
looking
the
at.
whole.
And we could look at your TSH and see if it's 11. If it's 11,
That's
you definitely would want to see a physician and get your thyroid in a euthyroid state.
But no matter what it
Right.
is, like, we would want you to see the physician.
If
Like,
it's
it would be
abnormal.
Right,
outside of our realm.
Right, and I talked to my primary about it, and he was gonna put me on stuff before I even got pregnant, like Armor. And I was like, "What's it made out of?" And he's like, "Pig." And I'm like, "Sorry, it's not kosher." And then you told me about that other stuff, and I haven't looked it up
the
yet.
thyrotropin from
Yeah. Because I'm not big on synthetic stuff anyway. Unless it's life or death, I'm just not gonna take a pharmaceutical. So like, I would do something else. I don't know what, but.
yeah, its standard process is called thyrotropin PMG. So I'm not sure what's in it, but
Right, yeah. No telling.
Do you feel like you felt the baby move yet?
I think, like, I'll lay down and I'll think, is that the baby moving? And so maybe, but it's very faint but I think,
it might be. Yeah.
but I mean,
It's right about the time you would start feeling the baby move.
yeah,
So,
I think so.
are you going to want to do here? Are you going to want to do an anatomic survey, an ultrasound, or do you?
Oh, the 18 weeks?
Mhm.
And that checks for possible defects, right?
Yeah.
I mean,
You're
Just
looking
make
at the
sure
anatomy.
everything's growing properly and bone length's correct for dates.
I've been planning on it.
Okay, I just didn't know. I know.
And as far as finding out the sex, my husband and I haven't actually talked about whether he wants to or not, but my problem is if I see it, I'm probably going to know just because I've looked at so many ultrasounds. But then again, it's going to be later, like, because the 13 weeks, they're kind of like this, and it's...
Well, most people also can see it at 18.
Oh, okay. So, yeah, I mean, I didn't want to get the, like, blood test thingy.
You don't want the genetic screen.
I don't think so. I mean, that's the one they do at a couple weeks ago, right?
Yeah, we could draw it today too.
And that, is that costing extra money too?
It costs about $100 extra,
Yeah.
yes.
And does it test for anything more than the anatomical thing?
Oh, it just tests for Down syndrome, trisomy 18, trisomy 13, and open neural tube defects. So it can't tell you about closed neural tube defects, and it's not going to tell you about any other thing that your baby could possibly have, and there's probably a list of 3 million genetic things that are out there.
Right. Which not all of them are that bad. Like you could have 6 fingers and it wouldn't be the worst thing in the world.
Right, but you might see 6 fingers on an ultrasound, but you're never going to get that on that blood test.
Right, right. Which that I wouldn't freak out about. I would just put it together.
So, okay, that's like the blood test isn't going to tell you about heart disease. You're going to get false positives and false negatives. There is a sequinome one.
False positives on blood tests?
Meaning sometimes it comes back going, this hormone is abnormally high and we think your risk is high and you need further testing, like amniocentesis.
But see, I wouldn't get amnio. Because amnio would put the fetus in danger, and then what am I going to do if it comes back anyway? You know what I mean?
Yeah, and I get really the genetic testing. There are some people, they've got to have a perfect baby, and if their baby is not perfect, then they don't want to have that baby.
Yeah, I'm not that
So
person.
these tests were invented for that, to make childbirth more perfect, more man-made.
Yeah, I'm totally not a eugenicist.
So,
I'm anti-Nazi. Sorry, I shouldn't say that. That's my political view. But yeah, I'll take the baby
as it comes.
as it comes, and hopefully it will be healthy. That's, you know. So I don't know if I want the genetic. I don't know. I know I want this ultrasound, because to me, like, so a Down syndrome baby would look normal on the ultrasound, right? But that's okay with me, because I'm okay with that. I mean, not that I'm saying I want that, but I could handle that. You know what I'm saying? But if there's something really wrong, that's not going to show up, and that is going to show up in the ultrasound, right? No?
Not necessarily. I think a spinal cord abnormality, because they always look at the spinal cord. A closed neural tube defect is not always visible, whereas sometimes open ones are, because you can just see that spina bifida changes.
And they can fix that in the womb too, right? Don't they?
Yeah.
So, but that's if I'm like a millionaire. Or
I don't know. You could see if TRICARE would fix that for you. It's amazing what they can do. Some babies can be saved. Like, we just had a friend who went through a baby with a blockage, babies in kidney failure. Started at 22 weeks, and they didn't know if the lungs matured, and so they induced at 34 weeks. They put her, there was never ever any fluid, so they did, the baby went into respiratory distress immediately after birth. But the baby's now off a ventilator and getting dialysis every 3 weeks. He's just been a miracle. So they've been trying to unblock the kidneys, hoping that the kidneys will regenerate, but
why would a kidney get blocked in the womb?
that, who knows, just some sort of genetic anomaly or some stricture in the growth of the urethra or something. But that's not something that you will find on the quad screen. It's not going to tell you.
The quad screen really
However,
just
the
tests
ultrasound told them, hey, there's no fluid here. What's wrong? So they sent her for more ultrasounds until they discovered, okay, this is what's wrong. And then they did genetic testings based upon the kidney problems.
Right.
Because they sometimes see that.
So
with
the quad
certain
screen
genetic
is what
things.
picked that up, is what you're saying.
I'm saying the
No,
ultrasound
the
picked
ultrasound
that up,
picked
but
it
the
up.
quad screen did not.
Okay.
That's what I mean by there are false negatives, meaning you're reassured everything's great with the baby.
Oh, right. But it's testing for 4 things, really.
Really, yes,
Okay.
and 3 million things could go
And
wrong.
so I know what Down syndrome is, but I know what genetically what trisomy means, but what are the effects of these
Trisomy
trisomy
18
things?
and trisomy 13, they're not compatible with life. The baby's born, and if you're lucky, it'll live till the baby's 21 months, but they usually die before birth.
Okay, so that is,
Yeah.
oh my gosh,
No,
would I
more.
want to know?
Yeah.
Okay, I don't know. I think I'll stick with my previous decision of just getting
Just
the
do
ultrasound.
Just do the ultrasound? Okay, that's fine.
Because if I don't want to worry my whole pregnancy that my baby's going to die. I'd
Yeah.
rather have the baby for 18
Yeah.
months or whatever. I don't know. Okay, yeah. I just don't. And that's what I've told people is like, I'm finally pregnant. I'm not promising a perfect baby. Like, you know?
Well, what human is ever perfect anyway?
Exactly,
We all
yeah.
have our personality flaws.
And Down syndrome babies, I can just say, are pretty darn perfect.
I know. That's the thing. One of my best friends in high school had a little brother with Down syndrome, and I used to babysit a girl with Down syndrome, and I think their souls are just pure.
Sure.
Just pure. And
They
so,
teach you joy.
yeah. And and then it's kind of like if you really love being a mother, you kind of have a kid that never grows up, too, in a lot of ways. So,